Hi everybody, welcome to week 2 of your evidence-based practice course. Thanks for the good discussion with the DQs in week 1. This week we will focus more on your individual EBP proposals. So it's getting exciting. Alright, so let's start with the first DQ for this week. You will post your DQ questions in the main forum under DQ1. So let's look at EBP PICO versus research PICO. All right. So first we have the population. Are we talking about med-surg inpatients, pediatric home care patients, surgical outpatients, whatever? You need to clearly define who the people are that you are proposing will be receiving the evidence-based practice. Okay. So that's the same. Intervention. So this is the actual practice that you are proposing to be implemented, okay? It may be a different way of doing a procedure, a certain method of teaching patients, a way to prevent complications, etc. You can be a little general now, but you will need to get more specific as you really delve into the evidence. For example, you might say that your intervention is enhanced discharge teaching. And as you go through the literature and find out what you can actually show to be effective through evidence, that might become teaching specific content and asking for teach back. So you might start out a little bit general and then you'll get more specific as the weeks go on. So that's a possibility. All right, comparison. Now, in a research PICO, we might be comparing like two different practices, two different types of dressings, whatever. In EBP, we are comparing this new intervention to the status quo. So you need to say, for comparison, what's currently being done in your institution or facility. So it might be compared to no intervention, if you're not doing anything in this area right now. Or it might be compared to the current dressing change, current teaching, current whatever. That's actually taking place at the facility. Because we're just comparing this latest, greatest, that's backed up by evidence, to what we're currently doing, okay? Then the outcome. What do you expect to change after the new practice has been implemented, okay? You will be looking at the same outcomes that you're finding in the literature. Please don't feel that you need to identify multiple outcomes, because eventually you're going to need to show that each of those outcomes is justified by the research studies and how you are going to measure every one of those outcomes. Hey, feel free if you want to do multiple. I'm just putting the warning out there that you don't need to, okay? Up to you. All right, time. How long are you willing to use the new practice before seeing some results, before doing that measurement of final outcome? And so the research studies you select can kind of help you with that. How long did it take them before they saw some positive outcomes? You do need to allow time for training, for getting the practice up and going, for getting the practice to be part of routine. So keep that in mind when you think about time. I believe your book has some excellent examples. I know they did in the last edition, but this course is the first course where we've uploaded the new edition. But I'm pretty sure they still have examples of how you can use these PICO components and put them in different orders depending on the type of EBP that you're proposing. Here is my example of one. In the adult medical inpatient population, will the use of the stand-up and go assessment lead to a 5% or greater decrease in fall rate over a 6-month period? Population adult inpatients. Intervention stand-up and go assessment. Comparison, I probably should have said compare to our current fall risk assessment tool. I apologize. Outcome, 5% or greater decrease in fall rate, time over a 6-month period. All right, so just an idea. Please know that your EBP will not be perfect at first, and you will most likely need to tweak it a little bit as you go along. So I'll try to give you feedback about DQ number 1 pretty quickly, and your classmates will also be helping you with their feedback. All right, DQ number 2 is fairly self-explanatory, so we're going to jump to the assignments. They're going to take a little bit of time to discuss. So each week, you're going to be writing different sections of an EBP proposal, and then at the end, you're going to be combining them all into one big proposal. So this week, we're going to be writing sections A and B. Okay, section A. You will be writing about your assessment of your selected organization's culture and readiness to implement EBP. Okay? So remember, in the first video, this has to be a real place with real people and real problems because you're going to be making the proposal specific to your site. So, you will use a tool to guide you, but you will not turn in that tool. Examples are provided in the appendix of your text. Please carefully review the directions and the expectations in the rubric. Please make sure that you've included all the required components listed there. Also note, the word limit is 250 words. Not counting the title page and the reference page. You need that for each section as we go through the weeks. So, an outcome of our program is that you'll be able to express yourself professionally in writing. That means learning to be clear and concise. So, don't exceed the 250 word limit and make sure that you're only including the required elements. This is professional writing. This isn't pleasure writing, this isn't expressive writing, it's technical writing, so clear and concise, okay? All right, section B is about describing the problem that your EBP is addressing. Now, you need to show that the issue is a problem not just to you, but that somebody else thinks it's a problem too, okay? So you can reference articles that say it's a problem. You can include info from interviewing somebody at your facility, like a quality manager, a nurse exec, somebody like that. This paper is more detailed, and now you have 500 to 750 words. So this is a longer paper. Please use headings for each section in the directions. I'm going to be grading a lot of papers, and I need to locate the required parts from the directions, okay? So here are a few tips. So look at the directions. Look at number 5. This is asking why the issue is also important, not just to you and somebody else, but why it's also important to nursing overall. Like, why is it important to the profession, to the science? Many people kind of skip over this one thinking that they included it when they said why it's important to somebody else. This is a little different, so make sure you get that one. And then number 6 in the directions, the initial reference list, that can be included in an appendix or in the paper. So if you're running into problems with word count, just cite it as an appendix and just tell me a little bit about the gist of the articles. Okay. All right. So once you've completed that first draft of this paper, go back down the list of directions and the rubric to make sure that you've included everything. Because if you skip something, I can't give you points for it, right? Okay. If writing is kind of a problem area for you, or you just want to double check like your grammar, you can copy and paste a paper into a site called grammarcheck.net. Grammarcheck, all one word, .net. Sometimes it's really helpful to do this before using Lopes Write. I think It's a little bit more refined than Lopes Right. You can see what you think. Also, I'm attaching GCU's 6th edition APA style guide to help you with formatting your references. You should already have this, but you might not have it at your fingertips, so I'm attaching it. All right, if you get stuck, send me a note in your individual forum. If we need to talk over the phone, still send me a note and we can set up a time to do that, okay? I can't choose your EBP for you, but I'm happy to provide any guidance that I can. I want you guys to be successful. I want this to be a good experience. I want you to learn something. So, I'm sure we'll be in contact. All right, guys, good luck, and I'll see you in the main forum.